Okay, well, welcome to the Preventive Medical Series Video 1, Inflammation When Healing Becomes Harm. Inflammation is really not bad. Without inflammation, you couldn't heal a cut, fight an infection, or recover from injury. It is one of the most powerful healing tools the body has. But inflammation was never meant to stay on. It was designed to turn on, do its thing, and then turn off and wait for the next injury. When it doesn't shut down properly, it quietly becomes one of the biggest drivers of chronic disease, from heart disease and diabetes to arthritis, dementia, and even cancer. Let's understand inflammation the right way because inflammation is not the enemy. Imagine you cut your finger while chopping vegetables. It happens, right? Within seconds, your body knows. Damaged cells release distress signals, cytokines, and prostaglandins, chemical messengers that act like emergency flares. Blood vessels in the area widen, that's why it turns red and warm. Fluid moves into the tissue, that's swelling. White blood cells arrive like paramedics. Neutrophils clear bacteria. Macrophages clean debris and coordinate repair. Clotting factors seal the wound. Growth factors activate new tissue forms. That redness, warmth, swelling, even tenderness, that's not damage. That's healing in motion. Inflammation is your body saying, I see the problem, I'm fixing it. And in a healthy system, once the threat is cleared, something remarkable happens. Anti-inflammatory signals rise, the alarm quiets, swelling subsides, the tissue remodels, the skin closes, the fire turns on, it does its job, and it turns off. That is acute inflammation, precise, intelligent, and life-saving. Now here's the problem. What happens when the signal never turns off? Not because of a cut, but because modern life keeps triggering it. Instead of a controlled burn, the fire begins to smolder, quietly, systemically, for years. And this is where inflammation shifts from healing to harm. Most people think inflammation starts in the joints or in their arteries or in the gut, but inflammation begins at the level of the cell membrane. Every cell in your body is wrapped in a double lipid membrane, a layer made of almost entirely of fats. This membrane is not just a wall, it's a communication center. Hormones dock here, nutrients pass through here, signals are generated there. This is where all your receptors are located. It is a place where the cells receive signals to do their thing. An extremely important communication area, that is the cell membrane. When the membrane is flexible and healthy, signals are balanced. When the membrane is rigid, damaged, or built from unstable fats, signals become exaggerated, especially inflammatory signals. So the inflammatory cascade begins in the fats that make up your cells. This is where diet becomes so powerful. The fats you eat literally become the fats in your cell membranes. If your diet is high in oxidized oils, industrial seed oils, and ultra-processed fats, those fats get incorporated into your cells, and different fats produce different signaling molecules. Some fats promote inflammatory compounds. Others help create molecules that actively resolve inflammation. Inflammation is not just an immune issue. It is a membrane issue. It is a fat quality issue. Now add fuel to that, like blood sugar spikes, chronic stress, gut permeability, excess body fat, environmental toxins. Each of these constantly stimulate inflammatory signals. The result? The fire never goes out. It smolders in blood vessels, in joints, in brain tissue, in the pancreas, in the liver. Over time, this silent inflammation stiffens arteries, damages nerves, accelerates aging, and creates the biological environment where chronic disease grows. Anti-inflammatory medications can be life-saving in acute situations, but chronically suppressing inflammation doesn't remove the cause. It's like pulling the battery out of a beeping alarm instead of fixing what triggered it. The noise stops, the irritation goes away, but the underlying problem continues to grow. True anti-inflammatory support does not silence the fire. It restores the system's ability to resolve it. And it begins at the membrane. Omega-3 fatty acids from fish or vegan sources get built into cell membranes and shift inflammatory signals towards resolution. I recommend 3 grams a day. Curcumin helps regulate inflammatory pathways while protecting membrane integrity. I often recommend 300 milligrams 3 times a day. Polyphenols from berries and green tea neutralize free radicals that damage fats in the membrane. Here, my recommendation is for 100 milligrams per day. Gut-supporting fibers reduce immune activation by strengthening the gut. I recommend that you consume at least 40 to 50 grams of fiber per day. Magnesium calms cellular signals and reduces nervous system-driven inflammation. My patients are very familiar with my recommendations of 300 milligrams in the morning and 300 milligrams at night. This combination doesn't silence the fire, it teaches the fire when to stop. Again, inflammation is not the enemy. It is the healing response that has lost its off switch. Chronic inflammation begins at the level of the cell membrane and the type of fats and stress signals we expose our body to every day. Preventative medicine isn't about suppressing symptoms. It's about restoring balance at the most functional level so the fire can do its job and then go out. And always remember, the body has an innate ability to heal itself. All you got to do is give it the right environment.